Cavities are quite common in adults these days because a lot of people have very acidic foods and acidic drinks, and that helps take away the mineral quality of the teeth and make it more vulnerable to cavities. So cavity is actually when the bacteria produces acid and starts to eat away at the enamel and softens it by removing the minerals in the teeth, which is actually called demineralization. Adults can absolutely get cavities even in their 40s, 50s, or 60s. It might be a side effect of medication because now they're producing less saliva, so they have less natural bacteria protection of the saliva washing the bacteria away and also creating a more acidic environment. Or the habits of having very acidic food and drink will actually pull the minerals out of the teeth and make you more vulnerable to cavities. Sometimes symptoms of a cavity can just easily be sensitivity to drinking or eating something hot or cold. Some people have no symptoms at all. It's actually lucky if you have symptoms because then it makes you go to the dentist and get it checked out. Cavities usually progress further when there are no symptoms at all because people assume that there's nothing wrong. So a cavity that is not treated and starts just at the surface, you might not detect it if you're not going to your dentist twice a year for checkups and x-ray checkups. But what happens is it progresses because more acid produced and it starts to eat away at the inside of the tooth. There are some consequences about not having the cavity treated or not knowing that you have a cavity. What can happen is the bacteria can actually penetrate deep into the tooth, into the nerve of the tooth, or what we call the pulp of the tooth. And then all of a sudden you get this extreme pain that might be keeping you up at night, and it's actually like a headache throbbing inside of the tooth. And what will happen is the nerve of the tooth will actually need to be removed by a procedure called a root canal. The most common misconception about a cavity is that a cavity is going to cause you a lot of pain. Most of the time when you're having pain from a cavity, it's already too late to get a filling or just a crown. It's usually at that point you're getting a root canal. Or you might be getting a little bit of sensitivity to cold when you're drinking something cold, but you're thinking, oh, maybe I'm just brushing too hard, and you kind of brush it off that it's not a cavity. Don't ignore the signs in your teeth. If your mouth is telling you there's something uncomfortable, it's important to go see the dentist.